Okay, welcome back. This is from ATI Chapter 13, Home Safety. So let's jump into this. So, not just protecting clients when they're in a healthcare setting, we also have to make sure that we protect them when they're at home. And, sometimes nurses do home care. You can do private duty home care, Medicare certified home care, because patients sometimes need additional services. They're not sick enough to be in the hospital any longer or even in subacute, but they still need some help. We can send social workers, occupational therapists, physical therapists to the patient's home to make sure that they get everything that they need. One of the biggest things is risk assessment. Risk assessment at home is a little bit different than risk assessments that we do in facilities because now the patient's in their own environment. We have to do a complete history, physical exam, and look for any hazards in the home, not just fall hazards, but other hazards. And there should always be a care plan inclusion for safety preparedness in case of an emergency. And in case there's any kind of a mass casualty, like if there's an earthquake or a hurricane or a tornado or any of those things. Okay. So risk assessment, complete a nursing history, and home hazard appraisal. There we go. All right. So risk factors for clients to get injured. Well, the big one can be age and developmental status. Developmental status refers to mentally, cognitively, where are they? Mobility and balance. Do they have good knowledge that's realistic about, what safety issues are, safety hazards? Do they have any sensory or cognitive impairments? How can they communicate? Do they communicate well? Do they work? What's that environment like? What do they do for a living? Yes, you have to ask those questions because do they work at a job that puts them at risk? Where do they live? And what are their lifestyle choices? In other words, are they monogamous? Do they have one sexual partner? Do they have multiple sexual partners? These are all questions that you have to ask. So let's start out with babies, infant and toddler safety. Big risk for aspiration, choking. No small objects. Always check toys for like loose parts or anything sharp. There are some things you never give a baby. Hard candy, peanuts, really any kind of nuts, popcorn, or whole or sliced pieces of hot dog. These are big choking hazards. When you're feeding the baby should never be flat. The baby should always have its head up, like, and never ever prop the bottle. And if the baby uses a pacifier, it should be a one-piece pacifier and never stick it on a ribbon or a string or anything like that around the baby's neck. I've seen that, and that's very dangerous. They can actually, choke themselves. Okay, dangers of suffocation. There's a mnemonic that they're using now, and it's called back to sleep, which makes you remember that you always put the baby on its back when you put it to sleep. Okay. Like I was telling you guys the other day, back in the day, when my kids were born, we put babies on their belly. Always, always put the baby on its belly. Well, sudden infant death syndrome, which we will talk about later, a lot of babies suffocated. So now, baby on the back to sleep. Make sure you keep any plastic bags out of reach. They can suffocate with those. Make sure the crib mattress fits snugly. And this is important because this is a question that the board may ask you. The slats on the crib can't be any more than 2 3/8 inches apart. If they're bigger than that, there's a chance that the baby can get a limb stuck in there or even its head. Okay. Never leave an infant or a toddler alone in the bathtub. And nothing should ever be in the crib. No bumper pads, no stuffed animals, no blankets, none of that. Remove any crib toys like mobiles that you have hanging over the crib as soon as the baby's big enough to kind of get up and grab them. Keep latex balloons away from them because they can swallow them and choke. If there's a swimming pool, my God, so many drownings. So many. If there's a swimming pool, keep it fenced and lock the gate and lock the doors and put the locks up at a level where the baby can't get to them. And as soon as they can, start swimming lessons. Start swimming lessons. I got my granddaughter swimming lessons when she was 2.5. We started. So just in case. Caregivers should all know CPR and Heimlich, just the basics. And I know this sounds crazy, but keep the toilet lids down and bathroom doors closed because kids will do the craziest things. Poisoning. There are lots of houseplants that are poisonous. So keep them out of reach as well as any cleaning agents. Don't let them eat the Tide Pods or drink your bleach. Okay. If any paint in your house is made from lead or has lead in it, you would have been told that because they did away with lead-based paint, my God, like 30 years ago. Because sometimes little kids, I mean, my kids never did this, but I guess some kids do, will put their mouths on windowsills if they're leaning over a windowsill, and they can ingest the lead from the paint, and that will cause permanent brain damage. Okay, so inspect and remove sources of lead. Anything that's poisonous, lock it up, right? Keep it away from the kid. Keep your medications away from the kid, locked up, and dispose of medications that are out of date or that you're not using anymore. Just eliminate as many hazards as you can. Falls. Kids fall all the time, but we're talking about a big fall, like out a window, right? Or out of the crib. When the baby's in the crib, you always keep the rails up. Same with playpens. Now they have those kind of foldable playpens, but always keep the rails up. Never leave a baby on a changing table unattended. Because you can say to yourself, oh, they can't roll over yet. And that will be the day that they will roll over and land on the floor. If you have stairs in your house, you have to have gates on them. Make sure the windows have screens. If you're using things like a high chair, swing, a stroller, those kinds of things, make sure that the kid is secured in those devices. They all have some type of securing device like a belt or a harness. And as soon as that kid starts climbing, put the bed in a low position. Get him a toddler bed or put a mattress on the floor. You don't want them falling. Car safety. Infants and toddlers should be rear facing until they're about 2 years of age or until they exceed the height and weight limit of the car seat. Then they can go into a front forward facing car seat. Okay. Use a car seat with a 5-point harness for infants and children. The retention clips. So a 5-point harness, the shoulder belts come over, they clip in the front, and then they clip between the legs to another point. The clips that are in the front that clip the two shoulder straps together, that's a retention clip. And it should be at the level of the baby's axilla, right at the level of their armpits, because that keeps the chest safe. Your car seat should be up to date and federally approved, and it should be in the back seat. However, if you have a car like a truck that doesn't have a back seat, you can put them in the front seat, rear facing, and disable the airbag. These are board questions. These are ATI predictor questions. Everything in this one slide, super important. Okay. Okay. Burns. This is another all too sadly common thing. When you are giving the baby a bath, test the water, not with your hand, but either with your elbow or the inner aspect of your arm, because your hand is not as sensitive to temperature. So it might be too hot. Same thing with formula. Never warm formula in a microwave. Is that there? That's not there. Oh, let me add that. Not warm formula. Formula in microwave. Because what happens in a microwave, the middle gets really hot and the outside doesn't. So you'll test it and it'll feel fine, but in the middle, it's very, very hot. Can burn their mouth. Always keep pots on the back burner and turn the handle away, like towards the back of the stove. Watch when they're using faucets. Don't let them get their hands on matches or lighters or cigarettes, and put safety covers on electrical outlets. That's all super, super important. We already kind of talked about water safety. Now we're at preschoolers and school age kids. Make sure they know how to swim. And if they are at the pool, make sure they're supervised, and make sure that when the pool's not in use, there's a fence around it, that they can't just get into it. Now, for older children, car seat safety, you would use a booster seat for children less than 4'9" and less than 40 pounds. Okay. So usually, like my granddaughter is 4 years old. Okay. And she weighs 42 pounds. But she's not 4'9". So we put her in a little booster seat, but in the back seat. The child should be able to sit with his back against the car seat and his legs should dangle over the seat. Then you know that's a good position for them to be in. With airbags, even without airbags, put the kids in the back seat if they're under 12. Once they outgrow boosters, put them in seat belts or belt seats, as my granddaughter calls them. Make sure that you're using protective equipment when they're riding a bike or participating in sports. Put a helmet on them, right? Teach them how to use equipment safely. I don't know what we did back in the day. We had sliding boards that were in playgrounds where they were on concrete. And in the summer, the sliding board was made of aluminum and it was 1,000 degrees and you would always burn the backs of your thighs going down. And then you would land on cement. Now, not so much, but we all survived. Teach the children never to run in the street. I've seen kids run in the street to grab, to get a ball, and they could come this close to getting killed. And make sure they know basic safety rules of the road, to look both ways, et cetera, et cetera. If you have a gun, keep them locked up, out of reach, okay? They should never touch a gun. And I mean, the guideline is to store bullets in a different location than the gun. If you do that, I don't know what good it is for self-defense, because what are you going to tell the criminal? You just wait a second. Let me get those bullets and put them in here. You picked the wrong house, buddy, didn't you? So you have to keep the gun, if you do have a gun, in a place where it absolutely is inaccessible to children. Okay. Too many times children have gotten their hands on guns thinking it's a toy, and they shoot their brother or sister or another child. Okay. And from the time they're young, teach your kids about alcohol is bad, cigarettes are bad. Not mine. No, mine are bad too. Drugs are bad, yada, yada, yada. And keep all potentially dangerous substances out of their reach, because kids tend to be very curious. Okay. We don't want anybody getting poisoned. This one we already did. Okay. Young and middle-aged adults. So, believe it or not, car crashes are the most common cause of death and injury to adults, right? And also occupational injuries. In other words, getting hurt on the job. Okay. And then alcohol and suicide, right? These are all things that are the things that take most middle-aged and younger people out of the life. Tell the kids don't drink and drive, right? So that they have that ingrained in their brain. Get an Uber, get a Lyft, get a friend. Alcohol has no benefit. Even red wine. I know for a long time people were saying red wine is good as an antioxidant. There's no benefit to alcohol. Now, I know it's delicious sometimes, but there is no benefit to it. So you should teach the kids about, long-term effects of alcohol can be very ugly. Hepatic encephalopathy. So make sure that you have a safe home, that you have smoke and carbon monoxide detectors. You only need carbon monoxide detectors if you have gas or oil powered furnace or hot water heater. If you have electric things don't put off carbon monoxide, so you wouldn't need it. But you would need a smoke alarm, fire alarm. Keep the staircases well lit and uncluttered. If you think that someone is so depressed that they may be thinking of suicide, be on the alert for that. Some subtle signs of people that are contemplating suicide are things like giving away all their prized possessions. So like I have a collection of antique books. If I suddenly started giving them away, something's up, right? So be alert for those kinds of things. Make sure they understand water safety. They should always be safe at work. I mean, discussing the dangers of social networking and the internet with children, teenagers, especially teenagers. Social media can be a real problem. There's cyberbullying now. There are people that are on things like Roblox that are grown men disguising themselves as 12-year-old kids, potential pedophiles. So very important that they understand, and it's sad that we have to talk about this, but they have to know that there are some bad people out there, okay? And make sure they protect themselves from the sun and wear sunscreen, okay? Skin cancer is a bad thing. Okay, older adults. So I love this first sentence. The rate at which age-related changing occurs varies greatly among older adults. So in other words, some people age better than others, okay? Many older people can maintain a lifestyle that's independent, right? Prevention is always better than trying to fix something after it happens. But there are some things that are kind of commonality when it comes to older folks. Tactile sensitivity, in other words, not feeling things and not being as highly sensitive as you were when you were younger, can put these older folks at risk for burns and injuries, right? If you find any kind of a hazard or a factor that increases their risk for injury, then you should do a complete home hazard evaluation anyway. I always did when I did home care. And maybe make a referral for PT or OT. If the client is using furniture to get up, need the table to get up and those types of things. They probably need a PT eval. Okay. So there are sometimes physical, cognitive, and sensory changes. Sometimes, right? Sometimes there's a decrease in hearing or vision. Sometimes they get up all night to pee. Not me. Not yet, anyway. Falls. So many fall risks. Things like throw rugs, loose carpets, electrical cords, extension cords, right? Make sure that they're out of the way. Look at them, watch them get up and walk. And like I said, if necessary, get them a referral or get them, an aid. And when I say aid, like a walker or a cane. Make sure that the steps, if there are steps to get into their house, are in good repair. They should have grab bars in the bathroom. More people fall in the bathroom. There should also be a non-skid mat, a shower chair if they need one, bedside commode if they need one, and make sure that every room in the house is adequately lit. Make sure they have emergency numbers near the phone, right? Everybody, not just older folks, everybody should have a fire extinguisher in their home, and they should be functional and they should know how to use it. And they should also have smoke detectors. And the thing with smoke detectors, if they are battery operated, you set a time, put it in the calendar or do something where they'll remember that the batteries have to be changed when the clocks fall behind or spring ahead in the fall and in the spring. And make sure there's some kind of an exit plan for a fire. Okay. People don't think about this, especially if you have a 2-story home. You're up on the second floor and the downstairs is on fire. People need to get out. How are you going to do that? And if you get out, where are you going to meet? Right. Remember, smoke rises, heat rises. If there is a fire, you want to deprive it of oxygen. Close the window, close the door. Get down as low as you can to the floor, like crawl. And if you can, get a damp cloth and put it over your mouth and nose. That helps to block out the smoke because the smoke can actually burn your lungs. Okay, if they have oxygen in the home, and this is one I've seen a million times too. Oxygen is combustible, flammable. My goodness, it's a mess. Make sure that oxygen tanks are standing straight up. Make sure that there's a no smoking sign somewhere conspicuous near the house. And if they want to smoke, don't let them blow themselves up. Turn off the oxygen and get the oxygen or get them away from the oxygen. Make sure they understand smoking is a problem with oxygen. Make sure electrical equipment is okay. They should never have anything made of wool if they're using oxygen. So no wool blankets, no wool sweaters. Those things are highly flammable with oxygen. And other things like heating oil, nail polish remover, very flammable. Away from the oxygen, and make sure they have fire extinguishers, like I said. Another thing that's flammable is, I'm going to add this, is petroleum jelly, Vaseline. They should never use that in their nostrils, their nares, if their nose is dry from using the oxygen. They should always use something that's a water-based lubricant, okay? But never Vaseline or petroleum jelly. Oh, we already did this. Okay. Carbon monoxide. Let me get rid of this. Carbon monoxide is a big danger. I think I talked about it briefly before, but so let's get into really what it is. Carbon monoxide is a gas that is part of emissions from engines or machines that are powered by either gasoline, natural gas, oil, or liquid propane. All right. So, in other words, if you have gas heat in your house, you have carbon monoxide, right? Gas hot water heater or liquid propane or any of those things, carbon monoxide. The emissions from your car, unless it's a totally electric car, emissions from your engine are carbon monoxide. Okay. It is very dangerous because it attaches to your hemoglobin. And basically, you don't have hemoglobin. All you have is carbon monoxide. It will kill you. Okay. You can't see it, you can't smell it, and you can't taste it. So there's like no warning sign with this. Okay. Um, Everybody that has anything that's powered by gas in their home or liquid propane should have carbon monoxide detectors, strategically placed. Make sure that there's proper ventilation. If people have things like a wood burning or gas fireplace or a charcoal grill, they have to be ventilated. I've seen people run kerosene heaters, right, in the home, dangerous, or generators that run on gasoline, running inside the home. Can't do that. It'll kill you. Okay. If you have a chimney and a fireplace, make sure the flue is cleaned. And again, carbon monoxide. All of this is important. So I'm highlighting all of it. Okay. So what is a primary survey? Primary survey is like a rapid, quicko assessment of any life-threatening conditions. And it shouldn't take more than 60 seconds. So like when I worked in the emergency room, somebody would come in that, with something that appeared life-threatening. I had to look them up and down and do like, what's going on? What's going on? And you always use standard precautions based on what is going on with body fluids. It could be just gloves. It could be gowns and gloves, whatever you need to protect you from any body fluids. And then there's something called the ABCDE principle. Okay. This is not the only thing that tells us how to prioritize care, but it is a very important part of it. And I'm going to explain. So A is for airway. Okay. Airway, cervical spine, neck. This is the most important step in the primary survey because if there's a cervical spine injury, you cannot do a neck tilt. You can do a chin thrust. Okay. They must have a patent airway. Anything that you do, if their airway is not patent, it's a waste of your time. Okay. And make sure that you protect the neck if you believe there's been a trauma, like if they were in a car accident. Breathing. Once you get an airway, see if they're breathing. And if they're breathing, is it shallow and useless or is it, enough to keep them perfused? Circulation. Once you know they're breathing, check the circulation. In other words, check their pulses. Do they have pulses? Disability. That's a quick assessment to determine their level of consciousness. In other words, are they awake, alert, and oriented? Do they have some type of an impairment? Are they confused? Are they disoriented, right? Exposure. You want to look at them again. It's a quick physical assessment. Were they exposed to extreme heat or extreme cold? And there's a piece in here we'll talk about frostbite and frost nip. You want to look at that. And there is a chapter in ATI, and we're going to go over that when we get to adult med surg, on all emergency nursing principles. We'll go over shock and all those fun things, but make sure you understand the ABCDE principle of primary and emergency care. Okay, very important. Okay, sprains, strains, and bleeding. Okay, sprains and strains. Somebody is playing pickleball and they twist just the wrong way on their ankle and they sprain or strain their ankle. Always remember the acronym RICE. R stands for either rest or refrain from weight bearing. So rest, ice, compression, elevation. Okay, that's the way you manage it. With a fresh injury, you want to refrain from weight bearing. So rest it, put ice on it, compression dressing to keep the swelling down, and elevate it above the level of the heart. So make sure you know RICE. Okay. Bleeding. If the person is bleeding, you apply very firm, direct pressure to the site that's bleeding. You see, this is in capital letters. Do not remove anything that's impaling the patient. In other words, if they were messing around and they fell onto, let's say they were impaled by a part of a fence, don't remove it. Just stabilize it and leave it in them until we get them to the hospital. Okay? Internal bleeding, I'll tell you, there are some signs of internal bleeding. There are no outward signs of blood because it's internal bleeding. But things like a rigid, very firm and distended abdomen can be a sign of internal bleeding. And things like tachycardia and hypotension at the same time are a big indicator of hypovolemia because of internal bleeding. Okay. We did sprains and strains, frostbite. Okay, frost nip or frostbite. So when you're exposed to freezing temperatures. And the most common sites for this are your earlobes, the tips of your nose, fingers, and toes. Okay. Frost nip is the milder one. And all you have to do is warm up. That's when you're just super cold. But frostbite is bad. Frostbite, the skin looks white and waxy. Okay. So it starts off being red and then it becomes white and waxy. And what's happening is the tissue is dying. Okay. And frostbite, like burns, can be full or partial thickness. You want to warm the affected area in water, right? Warm water. And it should be anywhere from 98.6, which is our core body temperature, to 108 degrees. Give them something for pain because let me tell you, it hurts. And they need a tetanus shot. And that is that. And last but not least, we're going to talk about CPR, cardiopulmonary resuscitation. So CPR is meant to save someone's life if their heart stops beating or if they stop breathing or both. What we're doing is when we are doing compressions, we are making the heart pump. Since it's not doing on its own, we're pushing on it to make it pump. Okay. The reason that we do compressions is if the patient doesn't have a pulse. The patient has a pulse, then we would do rescue breathing if they're not breathing. But if they're breathing and they have a pulse, then they wouldn't need CPR. Okay. So the goal of the whole thing, CPR, BLS, is to make sure that their brain and their organs are getting oxygenated blood flow until we can do something else, until some help gets there, right? So CAB is chest compression, airway breathing. You always assess the victim first. Hey, are you okay? Check to see if they're breathing. Don't do the whole look, listen, feel thing. Just, you can even stick your ear right next to their face to feel if they're breathing, okay? Call for help, right? If there's an AED around, get one. That's usually not the case. If there's a second person around, send them, hey, you go get help. Check the pulse. Begin CPR compressions alternating with breathing, okay? If there is a pulse, you wouldn't do compressions. So, and all the nurses should have had basic CPR, BLS, basic life support. And it's proven if someone does have a heart attack, that doing CPR, you are saving somebody's life, really saving their life. And that is the end. So let me stop the recording until next time. See ya.